In Africa today, access to sexual and reproductive health information and services is still limited. The largely underfunded health sector remains a major barrier to social-economic development. Young women and adolescent girls continue to grapple with female genital mutilation, early and forced marriage, gender-based violence, and limited access to family planning services. The International Planned Parenthood Federation Africa Region is the leading sexual and reproductive rights advocacy voice in the continent. We deliver much-needed sexual and reproductive health information and services to the poor, marginalized, and underserved. From 2005 to 2015, our work has been guided by the IPPF Global Strategic Framework.
The strategic framework is about the 5 A's, meaning adolescents and young people, HIV/AIDS, access, abortion, and of course, advocacy.
Through our network of 42 member associations, IPPF Africa delivered 69 million sexual and reproductive health services through 8,900 delivery points. The top 10 contributors to sexual and reproductive health services include Nigeria, Ethiopia, Uganda, Tanzania, DR Congo, Mozambique, Ghana, Kenya, and Burundi. In Ghana, PPAG has excelled in promoting vasectomy as a family planning method to men.
My name is Neil Odate. I'm a fisherman by trade. Every morning, I head out on the boats and catch the fish I will sell that day. I separate them and take them back to my kiosk to sell. 6 years ago, my father told me about vasectomy. He had heard the procedure. I accepted to go to the clinic to learn more about it, and the staff explained everything to me. They asked me to go home, think about it, and return in 2 weeks with my decision. After the 2 weeks, I decided to have the procedure. The doctor explained every step to me and informed me that once done, I was not going to father any more children. I already have 7 children. If I had not had the vasectomy over the past 6 years, I would have had 2, maybe 3 more, and we would be unable to take care of them. Having many children is a burden. Caring for them is difficult. My advice to other men is to get a vasectomy.
In Kenya, FHOK has made a huge impact on the lives of sexual and gender-based violence survivors.
It was 8:30 p.m. I was heading to my auntie's house. I decided to take a shortcut through a construction area. I walked past 3 men. Then I noticed they were following me. They grabbed me and dragged me into one of the houses under construction. Each of them raped me and they left. My cousin begged me to go to hospital, but I was adamant. I did not want people to find out what had happened to me. I was so damaged, I did not want a doctor to examine me. I felt very ashamed and dirty. Instead, we went to a traditional healer for some herbs. 2 months later, I realized I was pregnant. My parents denounced me. They refused to believe I was gang raped. I lost all hope and started drinking heavily. I wanted to die. When I was 3 months pregnant, I tried to terminate my pregnancy and I failed. At 7 months, I tried again and once more I failed. I gave birth to a healthy baby girl. We had no money, no food, nothing. I turned to prostitution. A few months later, I fell ill. I was still very traumatized from the rape. I would look at the baby sometimes and want to kill her. A lady in the neighborhood introduced me to IPPF's Family Health Options Kenya. They have been of great help to me. I have undergone counseling and my attitude towards men and life has changed for the better. They also started me on contraceptives, and if it were not for them, I would have had another pregnancy.
In Uganda, RHU increased male involvement in SRHR through their young men as equal partners and male involvement learning projects.
My name's Tugume Ananias. I'm a peer educator in reproductive health Uganda. I started being there as a peer educator during the time of the other project was called Young Men as Equal Partners, because we did a lot and people appreciated, and even in the headquarters of RHU, we were given another project which was called Male Involvement Learning Center Initiative. I'm married with 4 children. When I joined the RHU, I learned very many things. That where a woman was supposed to be treated as a human being, I think in the other time, I was behaving like the other very old men who think that a wife is like a property at home. But when we joined Young Men as Equal Partners, we are told to share things at home, like the domestic work, which we were leaving for only women. When I'm at home here, I'm always comfortable when I'm doing this domestic work, and this is what they used to say, that it is for women. But with me, if I'm doing it, and even my wife appreciates, because she sees a man doing what other men are not doing. And she even says that RHU did a lot for her. This is what I could not do even in the past, but these days I do it and I don't get any problem. And when I do it, we are peaceful at home. I urge other men to come in and begin doing this work, because it is not reducing on their manhood. They will remain husbands, they will remain men. It is better to work together, and that's what we are calling male involvement.
In Ethiopia, FGAE has recorded great successes in its work to promote equal marriage partnerships and end the practice of forced early marriages. By the conclusion of a 3-year project tackling early marriages, 245 child marriages were stopped.
My name is Mekedi Sechilo. When I was 7 years old, my parents decided to marry me off. I told my school principal that my parents planned to give me away in marriage. He confronted them and asked why they were going to marry me off at such a young age. They told him that all my age mates were getting married. What made me different? The school principal reported the matter to the police. I had also heard about an FGAE project for the prevention of early marriage. Project members in my area regularly organize discussions on early marriage and how to prevent it. I approached them for help. With the support of FGAE, the school principal, and the police, the wedding ceremony was cancelled. I am now in 10th grade. This project prevented many girls, including myself, from getting married too early. Even today, the cases of early marriage have reduced significantly in our community. Parents are now sending their daughters to school for education.
In Côte d'Ivoire, IPPF has become the national reference point for the fight against female genital mutilation. In 2006, their advocacy and intervention contributed to a 20% reduction of female genital mutilation in project areas.
My name is Namosa Dosa from the village of Tiema Soba. I was circumcised at the age of 12. It was a custom and obligation to be circumcised for the honor of the family. We were 15 girls of different ages. The adults neutralized us and forced us to undergo an act which in hindsight is humiliating and degrading. After the cut, I bled a lot and felt very weak. I saw the other girls writhe in pain and lose consciousness around me. The sensitization project initiated by IPPF and IPPF in the locality has led to a certain level of awareness within the community, so much so that the village chief has banned circumcision of girls altogether.
My name is Musa Doso, the village chief of Tiema Soba. The IPPF project convinced the population concerning the harmful aspects of female circumcision. On behalf of the villagers, I thank and congratulate IPPF. The abandoning of the practice of female circumcision is a total relief to the population, and we support the law that prohibits it.
In Togo, IPPF increased access to family planning by using community health workers to deliver short-term contraceptive methods.
My name is Kojo Gaston, and I'm a football player. Like many other people in this village, I had 2 children within 1.5 years. On my return from a trip, I learned that one of our sisters had attended training on the provision of family planning services. I personally went to her house to understand what it involved. When I weighed the benefits, I agreed with my wife and accompanied her to the hospital for a 5-year contraceptive method. The adoption of contraceptives has had a positive impact on our lives in the village. I have lived in this village for 2 years. During this time, I noticed that the frequency of childbirths had declined. Children and their mothers are healthier.
In Uganda, RHU's community-based HIV/AIDS prevention, care, and support services project is increasing access to and quality of HIV prevention, care, support to vulnerable populations, and enhancing the capacity of indigenous organizations in delivering results.
My name is Hakulo Jawan. I work with Reproductive Health Uganda Lira branch as a service provider. I work both at the clinic and then outreach. We are running out a community-based HIV/AIDS project, prevention, care, and support. We basically see integration of services. We don't only focus on HIV. We bring in the component of family planning. We look at OVC. We do cervical cancer screening. We do psychosocial counseling, and then other health-related issues. In 2011, we organized an outreach, and Lily came for testing, and she turned out to be HIV positive.
My name is Awar Lily. My husband is Nina Sam, and my co-wife is Lillian. Together, we have 14 children, and this is our home. Lillian and I attended a Reproductive Health Uganda outreach clinic in our village. We were tested for HIV and found out we were positive. We were referred to the local hospital for further treatment.
She received psychosocial counseling. She was enrolled on Septrin and referred for a CD4 cell count testing to the Health Center 4, which is within the sub-county. In April 2012, we saw the need to make follow-up for the family. Since the 2 women are already HIV positive, we organized a home visit to see to it that the rest of the family members are tested, the children and the husband. When we tested the 14 children, 1 child, the son to Lillian, turned out to be positive, the youngest. We are glad the child is enrolled on Septrin and is on HEART. Right now, I am glad the child is being looked after as a vulnerable child within that project.
Our success is the result of innovative service delivery models. IPPF Africa's commitment to quality youth-friendly services and empowering young people and adolescents is important and cannot be overstated.
I am Isidore Kwessan Jifa, a law student at the University of Lomé and the current Youth Action Movement president at IPPF. In 2014, I responded to a call for proposals by IPPF Africa Region. My proposal was titled, Act Now for the Sexual and Reproductive Health of Adolescents and the Youth. It was accepted and I was invited to the Nairobi regional offices for an internship, and I also received a grant to implement the project in Togo. The project is based on the Ouagadougou document, resulting from the Ouagadougou conference that recommended the need for effective and rapid implementation of sexual health and reproductive health of adolescents and the youth. This opportunity has greatly improved my ability to advocate for adolescents and the youth. My relationship with institutions and with leaders has improved. Today, we have a national pregnancy prevention program as well as an anti-early marriage program. The youth action movement is very involved in SRHR advocacy at national level.
Over 38,000 local volunteers form the backbone of IPPF service delivery in sub-Saharan Africa.
The most important thing is for the volunteers to advocate, for mission, values, and vision of IPPF with their governments. The volunteers have to show the government that IPPF indeed can be a partner to government because we complement, the services of government.
IPPF Africa continues to influence SRHR policy changes and positions. Through our 42 member associations, 90 new policies were passed during the period under review in support of SRHR at a continental and national levels.
The African continent was the first continent to adopt a continental plan on sexual and reproductive health and rights. We drafted, together with IPPF and relevant partners, the policy framework on sexual and reproductive health and rights. Maputo has helped us to put issues that concern women and child health on the African agenda.
Despite progress made in addressing SRHR gaps in sub-Saharan Africa, much remains to be done. IPPF Africa is committed to advocate governments to respect, protect, and fulfill sexual and reproductive rights and equality, that young people, men and women, are empowered to act freely on their sexual and reproductive health and rights, that they have access to quality integrated sexual and reproductive health services.
The world is in pain. People are suffering all over the world, either to man-made or natural factors. Let's all work to heal the world.
If we can have this world where there is no discrimination, if we can have this world where there is no stigmatization, if we can have this world where we consider each of us equal to access reproductive health services and use appropriately accordingly their rights, I think we will be very helpful to the development of our continent.